Today I'll be talking about GLP-1s without shame, how to decide what's right for your body. All right, so I usually hear this question from a lot of patients. They ask me, "Hey, Dr. J, should I be on a GLP-1?" But what they're actually asking is, is something wrong with me if I need help? And so it's important also as a physician that when I get a question, I am always interpreting what is really beneath the surface of the actual question. Another question that is below the surface of if they should be on a GLP-1 is, have I failed if I consider a GLP-1? So many women worry about the following when it comes to these questions. They worry about judgment. So, what are other people going to think about me if I were to start a GLP-1? They worry about taking the easy way out. Are people going to think I'm lazy if I take a GLP-1? They worry about regaining weight because we know that as soon as you get off a GLP-1, you can get about 20% of the weight that you've lost back. They worry about losing muscle because GLP-1s decrease your appetite. There is a possibility of losing muscle, especially when you're not getting those important macronutrients to help maintain the muscle. And they just worry about doing it all wrong. So, requiring support does not equal failure. Requiring physiology, that actually is what leads to failure. But I often have to reiterate that being on a GLP-1 does not mean that you are wrong, does not mean that you're lazy. It's just recognizing that your physiology, the way that your body has been designed, requires a special kind of support. Oh, my other. Okay. Hold on. Let me just make sure my slides are in succession because it seems like I may have missed. Yes. Okay, perfect. So we'll do it from here. And so the whole point of this is that you do not need shame when you're on a GLP-1. What you really do need is a strategy. So, who am I? My name is Dr. J. I'm a double certified internal medicine physician and a sports medicine physician, and I am the founder of Invessel Health and Wellness. And the reason why I'm passionate about this was because of my own journey. So, I actually struggled with obesity as a child. And in my mid 30s, I had gained about 18 pounds. And my LDL cholesterol was the highest it has ever been in my life. And at the same time, I was working with patients who had obesity, and I realized that a lot of the struggles that I was going through, my patients were going through, especially with the women I noticed who were around my same age, they were experiencing the same changes in their own body. And so that led me to go even deeper, deeper into nutrition, deeper in understanding what movements help us during this time while our bodies are changing. And that led me to create Invessel Health and Wellness, which is my practice, which I started in 2025. And my whole mission with Invessel Health and Wellness is to transform the way that women see and experience healthcare. Because from what I believe, and also from what we see in healthcare right now, a lot of studies, they were not done on women. And what you see right now sometimes have been done on men. And so sometimes it's hard to take those same studies that have been done on men and to equate it to women. And I find that, being a woman physician who is going through changes in her own body, it allows me to better relate to my patients who are women, and it also allows me to dig deeper into the medical literature and also discuss with colleagues who are concerned about women's health to find out how we can best help women and treat women in a way that they feel safe and they feel heard and they feel understood. Okay, so does this story sound familiar? And so a lot of my patients, they're very high achieving women. They're doctors, they're lawyers, they are professional women at the top of their game. And so usually because these women, they're so disciplined and they're so focused, they actually do all the right things. And so usually they're doing these things. They're eating clean. They're exercising. They are tracking their food and they're staying consistent, right? So usually they are doing all the right things, but the issue is that their body's not responding. So that's a story that I hear every time. There's a high achieving woman. She is disciplined everywhere else in life, but her body was not responding. So let's dig into just how GLP-1s work. And so there are three main mechanisms of action in which they work. The number one, they reduce the appetite. They reduce gastric emptying. So what that means is that they slow food transit out the stomach, and therefore food stays in the stomach longer than typical, and that induces satiety or fullness. And then number three, it increases insulin secretion in the setting of a carbohydrate load. So what that means is that when you are eating any type of carbohydrates, it helps to stimulate the insulin response, and the insulin brings the sugar from the blood into the cells where it could be used for energy so that the sugar is not hanging out in the blood and causing high blood sugar, which an accumulation of that over time can lead to type 2 diabetes. So these are the mechanism of action of the GLP-1. Now, without a plan on a GLP-1, these are the things that can happen. It can lead to muscle loss because, like I said, one of the mechanisms of action is that it helps to reduce your appetite. So, if you're reducing your appetite so much so that you're not hungry, you're not getting sufficient macronutrients like protein that help to maintain your muscle. It lowers metabolism because it can because inadequate nutrition on a GLP-1 can lead to muscle loss. Loss of muscle can lower your metabolism. And when your metabolism is lowered, that makes it more difficult for the body fat to be released. And so it's much easier to for the fats to remain stored. It can lead to fatigue because you're not getting the proper macro and you're probably not even getting the proper micronutrients. And then it also can lead to plateaus, especially when it is not paired with an adequate nutrition and strength training regimen. So I want you to meet a fictitious patient of mine. This is Laura. She is 35 years old. She has a history of prediabetes and PCOS. She is an IT consultant. And like a lot of the patients that I mentioned previously, she was doing everything right. She was exercising, she was eating clean, she was tracking, she was doing all the things. She was doing everything that she knows to do. However, when she got on a GLP-1, her appetite decreased to the point where she did not even feel like eating. And because of that, she had a fear of losing muscle. So, with Laura and many patients like Laura, people like this, they need a strategy because that fear is real. The fear of losing muscle is real. And so we have to be very strategic when that problem presents itself, especially if you're not hungry and you don't want to eat. There is a real fear of losing muscle. So we went through this 4F strategy. So, first is protein. That's first, fiber, fluids, and fats. And we're going to go through this. So, first is protein and fiber. That's first. And then carbs after. So with fiber, you can do things like adding chia, flax, berries, and when you're on a GLP-1, it's more important to focus on the density of the nutrients, not necessarily the volume. Because, like I said, GLP-1, it makes you fuller faster. So in Laura, we had to focus on making sure she was getting those proper macronutrients like the protein and the fiber first, right? So focusing on the density of nutrients and not necessarily having a lot of volume on the plate because when there's more volume, you're going to get fuller faster. And it's important when you're on a GLP-1 to get those key nutrients first, which is protein and fiber, because especially the protein is going to help maintain the muscle, and that's what we certainly want to do in Laura. And then the fiber as well. The fiber is just great all around. It's great for the gut microbiome. It has antioxidants. It's anti-inflammatory. So certainly want to make sure that we get in both the protein and fiber, making sure that she has those nutrients in first. And then when it comes to fluids, we're gonna pause fluids 30 minutes before meals and 1 hour after because this is the whole thing. Remember Laura? Laura did not feel like eating. And so when you're on a GLP-1, we have to make sure that we are not having an over intake of fluids to prevent the fullness because when you are full, you're going to miss out on those key nutrients that is going to help you maintain muscle. So we always have to pause fluids. And then the last thing is fats, which is the fourth F. And so the fats are very satiating. And so when you eat too much of it, you're going to get fuller faster. And that's why when you're on a GLP-1, we have to do everything in succession to make sure that you're having the adequate nutrients first to maintain muscle, right? So it's first the protein and the fiber, then pausing the fluids, then the fats. So those are the 4F strategy, which we implemented on Laura so that she can eat, so that she would not reach a level of satiety too quickly, so that she can maintain her muscle mass. Because if she's not maintaining her muscle mass, then we're going the opposite direction. She's going to lower her metabolism, and that's going to help her hold on to fat longer, which then defeats the whole purpose of her being on a GLP-1 anyway. And this is just benefits of muscle. What muscle helps you do is keeping your basal metabolic rate higher, which is your metabolism, helps to raise your metabolism. And then when you have muscle on, when you are gaining muscle mass and when you're able to preserve muscle mass, your body then burns calories when you sleep. And so that's the whole purpose of keeping your metabolism high, which is what muscle does. So muscle raises your specifically your what is called your basal metabolic rate, and raising of your metabolic basal metabolic rate that allows you to help you burn calories when you are at rest. Muscle, it helps to improve insulin sensitivity. And so your cells are much more likely to respond to insulin, which brings the sugar into the cells and keeps it less in the bloodstream. And then you're able to maintain these results over time. This allows it to be sustainable, which is what we want. We want to make fat loss sustainable. And then in terms of strength training, the really minimum effective dose to help you maintain muscle, right? Not necessarily gain muscle, but to maintain and preserve muscle is 10 minutes 3 times a week. 10 minutes 3 times a week doing exercises that stimulate the muscle, that moves the muscle across a specific range of motion. So this could be if you do, squats for 10 minutes, if you do lunges for 10 minutes, um, things like that. That's going to help stimulate the muscle against resistance, and that's going to help maintain the muscle, which is important in any type of fat loss and even muscle gain strategy. So, the GLP is a tool. It is not magic. It does not mean that you have failed. It is simply a tool to help you achieve a certain result. And who succeeds long term? The women who succeed long term, they're those who prioritize protein. They are those women who strength train. They focus on nutrient density, not necessarily volume of food, but nutrient density. And last but not least, these are the women who have a strategy. So it's more than just taking the medication. And I feel like social media, it can be so confusing when you go on social media and you're seeing people on GLP-1s and it looks that it's as simple as just taking a medication. But there is an actual strategy for someone to be successful on this medication because there can be side effects if it is not taken the appropriate way. And the whole point of this and what I want to emphasize is that you do not need shame, right? There's also a lot of shame that comes with GLP-1s. You don't need shame, but what you do need is a strategy to help you get to your desired result. And also, not everybody needs a GLP-1. Not everyone needs a GLP-1. There are some people that are able to lose weight without a GLP-1. Um, but again, everyone needs a strategy for them to be successful because even without a GLP-1, knowing what type of macronutrients to eat and what portion sizes is important to help you get to your desired result, whether it is fat loss or muscle gain. Now, if you want clarity, I am offering consultations, and then I can help you learn what your options are. I can help you build a plan and just remove the guesswork of knowing what your next step could be. And so if you click that QR code, that will direct you to a consultation call with me, and we'll focus on clarity for you. We'll focus on, okay, what steps do you have to take in order to even gain clarity if a GLP-1 is something that you need or a GLP-1 is something that you don't need. But the most important thing is that you get clarity on your next best step.